Hello everyone. Thank you for joining us today. Today we are searching for a healthcare system that truly delivers, that's efficient, accessible, and provides high quality care to everyone. When billions of people are facing challenges like limited access to healthcare, long waited times, and just simply unaffordable healthcare system. Is that even possible? Joining us today is a renowned doctor and a health tech maestro, Dr. Abhay Chapada. Let's begin with discussion with him.
Thank you so much for inviting me. Let me explain my background. My name is Abhay Chapada. I'm actually a colorectal surgeon by training. But over the years, I've got a huge interest in looking at technologies and how we can leverage the technologies to transform the future of healthcare. I had a very early interest in technology ever since my young days, and I've developed that further. And the concept is a lot of the world is now a transformed world. Where previously, for instance, if I wanted to make a phone call, I had to go to or book a phone call if I wanted to speak overseas, and now I can do it in a matter of seconds. In addition to this, I'm also a very keen technophile. I am the London chairman of VAPIO. I'm an international envoy for Symbiosis University. I'm a visiting professor of surgery for Symbiosis. So look, I wear a lot of hats, but my core calling remains: how can you make healthcare accessible to the planet, where people are even today dying because they can't see a doctor?
So, what exactly do you think of an ideal healthcare system? Like affordability, accessibility, and quality of care? Can we have it all? Or should an ideal system prioritize one over another? Or just have a healthy balance of them all? What do you think about that?
That's a very interesting question. Healthcare is synonymous with living a good quality life. Do you want good quality healthcare to be accessible? Absolutely yes. Do you want it to be affordable? That's a question that is actually a very delicate balance, because affordability is down to how is it provided. So there are countries in the world like the UK where it is all socialized. So then affordability becomes a very relative question. But in an ideal world, yes, I would like it to be accessible, available, and affordable. Given the context of modern technology, not only are these easily achievable, but desirable.
So, like we just talked about, the cost of healthcare is a global concern. How can we ensure high quality care at an affordable price for even individuals and the governmental systems?
We have to start rethinking the healthcare paradigm. And in healthcare, the key problem we have currently today is the lack of data mobility. So essentially what happens is the system is designed around the caregiver's availability. So let me put a very practical example. Let's assume you have a clinical problem. You would actually seek his appointment as per his availability. And that is a first hurdle. Remember, if I can't see a doctor within the first few hours of the symptoms, my condition is going to get more and more complex, which means that it is going to get less and less affordable.
Right.
So the time lost in access is a huge reason why affordability becomes a concern. The second part about it is availability of healthcare doesn't mean just access to any doctor. It needs access to a doctor that actually has the right skills for you. So going to a general practitioner when you've got a problem that needs a specialist is probably worthless. That's the second reason why delays happen. And if you actually eliminate the access part and affordable part, there's something else that happens is that you now need a lot less intervention. You also can leverage technologies to get insights without access to very expensive technologies like CT scanners or MRIs. So you can start looking at the affordability conundrum from quickness or the speed of access. Because let me put it again, that if I find a problem early enough, let's say the cost is X. If I delay it by a day, the cost is not 2X. It can be exponential of X. Because the human body keeps deteriorating in an exponential fashion. Classic example of someone having sepsis. If I find him within the first couple of hours and give him antibiotics, he won't even recognize that he ever had a problem with sepsis. But that same sepsis, if it festers over a 4 or 5 day period, the cost of recovering him from that excessive sepsis is in hundreds of thousands of dollars. So can you understand that it is the speed and ease of access that will allow us to look at the affordability conundrum?
Well, yeah, there'll be challenges and there are challenges. What steps do you think we can take to actually overcome all these challenges and have a brighter future for healthcare?
So let's first understand where the challenges lie, and the challenges lie in the distribution of healthcare providers. So today, if you look at specialists, they're almost always in the urban areas. They'll not be in the rural areas. But what if I don't need any doctor in the rural area? I can put a health ATM there, where a villager can go and connect with any specialist at any time. So first is access to the care provider. The second barrier is communication. How can a Spanish patient talk with, let's say, a Hindi doctor? Or how can a Hindi patient access a French doctor? So what we've done is we've actually leveraged technology here as well. We've said, okay, hang on, at the end of the day, it's just communication. Why can't I use AI, a lot of translation tools, so the communication can happen in real time? Now if you overcome these two challenges where the doctor is available anywhere, anytime, in any language, you solve this conundrum. It sounds futuristic, but I assure you it's done, it's doable, we are scaling.
This episode was all about an ideal healthcare system, the possibilities and challenges for the same. Thank you, Dr. Abhay Chopada. This was a very insightful and thought-provoking session.
Thank you so much. Thank you for the opportunity.
I hope our audience liked it too. Thank you for joining us today.